Hello, welcome back to Simply Women's Health with CJ. Today we're going to talk about week 12 of your pregnancy. At this point, your uterus is now about as big as a grapefruit. If this is your first baby, you still have excellent abdominal tone and probably don't have much of a bump just yet. If this is not your first baby, that tone just isn't what it used to be, and you may very well be seeing a baby bump. Within that uterus, your tiny human is now just over 2 inches long, or about as big as a lime, and weighs about 2 ounces, or the same as a tennis ball. The major organs are developed and are beginning to function. The baby is opening and closing his or her little hands, drinking their amniotic fluid, and making urine. The baby is moving all over the place inside your uterus. If it's your first baby, you are probably not feeling any fetal movement just yet. If this is not your first baby, I have had moms that have said they have felt fetal movement as early as 12 weeks. The baby's heart is beating about 140 to 170 times per minute. Now, can you tell the gender based on the heartbeat? There is an old wives' tale that says if the heart beats fast, it's a girl. If it's slow, it's a boy. This is an old wives' tale. There is no scientific evidence that backs this up. That being said, it is kind of fun to guess. At this point, the placenta has now reached maturity, so those hormone levels are going to start tapering off. They're not going to go away overnight. They will go away gradually. So over the next couple of weeks, you will notice that those symptoms do start to simmer down. It is still normal at 12 weeks for you to have nausea, vomiting, breast tenderness, and fatigue. It's normal for you to have the occasional cramp, the occasional twinge, the occasional spot of blood after sex, round ligament pain, stretching pains every time you sneeze, laugh, cough, roll over in bed, bend over to tie your shoes. If this is a second baby, those round ligament pains are much earlier and much more intense than they were with the first baby. What's not okay at this point? Bright red bleeding that's enough to saturate a pad. It's not okay for you to have cramping that won't go away or severe pain of any kind that is persistent. At 12 weeks, if you have gone to see your OB provider, they might have recommended that you start taking a baby aspirin. The purpose of this baby aspirin is to thin out your blood a little bit just in case you develop a condition called preeclampsia at the end of your pregnancy. Preeclampsia is what scares us the most in pregnancy. We don't know who's going to get it. We don't know how to prevent it. We do know that there are some people that are more at risk. If you have chronic hypertension, if you've had preeclampsia in the past, if your mother or your sister had preeclampsia, if it's your first baby, if your body mass index is greater than 40, if you are of African American descent, these are all things that do unfortunately increase your risk for preeclampsia. If your provider has recommended you take a baby aspirin, I strongly encourage you to follow that recommendation. At your OB visit, they're also going to want to talk to you about genetic testing. 2 different kinds of genetic tests. The first one is what's called aneuploidy. The purpose of that testing is to see if your baby is at increased risk to have a genetic abnormality. There is also carrier testing to see if you carry any genetic abnormalities that can affect your baby. These are just blood tests, nothing invasive. So what questions do you have? I would love it if you would leave them in the comments section below. And while you're down there, go ahead and hit that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.